Hello, ladies and gentlemen, and thank you so much, for a new season of Brain Talk. And this time we'll talk, about the 11 disorders in the brain that will enhance with you. Actually, it's not only just in the brain, in the central nervous system, brain, including the spinal cord. So we have here an 11 types or patterns of the enhancement. Firstly, we have here the diffuse dural enhancement. Second is a focal dural enhancement, and we have a leptomeningeal enhancement, gyral enhancement, also the periventricular enhancement, perivascular, and number 7 here, nodular or mass-like enhancement, a smooth ring enhancement, irregular enhancement, and here open ring enhancement also. Lastly, we'll talk about the cyst, which have a nodule inside. So a normal enhancement, because some structures in the brain, they don't have the blood brain barrier, so they show normal enhancement. We have the dura mater and pineal gland, blood vessels, pituitary stalk and pituitary, and also choroid plexus, medulla oblongata, the area postrema. This here shows actually normal enhancement in the brain. Here, this is the pictures of the normal anatomy, which shows a normal enhancement. As we say here, this blood vessels, here pineal gland. Here is the medulla oblongata, area postrema, and here this is pituitary gland, here pituitary stalk, and here's the normal dura. So here, as we see, the dura mater is an extraaxial structure, which shows it has a blood, it has no blood brain barrier. So about half of the patient or people will show or so contrast enhancement and thin layers, and sometimes this discontinuous line like enhancement. So we'll start firstly with the diffuse dural pattern, which which diseases can cause the diffuse dural pattern, or any normal pathology that can show diffuse dural pattern. We have here firstly this any surgery in the brain can cause diffuse dural pattern. We also in the intracranial hypotension, patient with meningitis, carcinomatosa, and also sinus thrombosis, granuloma, sarcoid, also TB, and lastly IgG4 related diseases. So we'll talk here about the intracranial hypotension syndrome. Is a typical presentation, and patient will just only complain of upright headache. There is spontaneous CSF leak seen in the anterior cerebral dura mater laceration. This is called type 1, and also nerve root diverticulum leakage. This is type 2. Or there is the CSF venous fistula, and this is a type 3. So further finding the cause of CSF leakage is requires sometimes the imaging of whole spine. The treatment of this leakage will be using a epidural patch. So MRI finding here, well, firstly, this 10% will show normal, and actually will have this some cerebral prolapse and secondary changes. What is secondary changes? Will have this drop of the splenium of the corpus callosum. Hypothalamus will be show slow and flat. Sometimes it close to the pituitary and dorsal sella or dosum sella, and also the shortening of the midbrain and herniation of tonsils of the cerebellum. Finding number 2, this is about increasing venous pressure. You will have like diffuse thickening and enhancement of the dura mater, and also this is a dilation of the venous sinuses, and lastly here swelling of the pituitary. Finding 3 of MRI there's some it's called secondary changes, like narrowing of the ventricle system. Veins will pulled and ruptured, and you will see like subdural hematoma. Sometimes it's like hygroma. So here is the diffuse, thickening of cerebral dura matter, and also narrowing of the ventricle system, which cannot shown as a normal MRI in normal people. Here also will show this is two patient. No, I'm sorry, this is one patient who starting here before treatment. Here after treatment, as you see in the before treatment, the main manifestation was cerebellum, cerebellum ptosis. They will see the splenium of the corpus callosum, hypothalamus, and also midbrain. All of them, and tonsils also of the cerebellum, all of them, prolapse or, ptosis. And it will show here a significant, improvement in the cerebrum prolapse after treatment. Here, another, we'll see this edematous extra, cerebellum, edematous appearance, and this is with enhancement. We'll show this, the dura will enhance, and also the thickening of the dura mater. Also in the other picture here of the superior sagittal sinus, and also the transfer sinuses here, will also cervical spine, spinal venous plexus. All of them will show this is expansion, and also here will show the cerebellum ptosis here. IgG for correlation, hypertrophic meningitis. This is IgG4 is a autoimmune disease that can affect many organs in the human body, including the pancreas. And also this is will sometimes show in the brain enhancement of the diffuse enhancement of the dura mater. Secondly, we'll talk about focal dura pattern. That is, will show sometimes we see it in post-ulcer surgery and meningioma, also metastasis, also here lympho proliferative and granuloma, like circuit disease, TB, and also the same IgG4 disease. Here, the meningioma, the most seen size for meningioma will be this convexity, olfactory groove, cerebrocellular, clivus, foramen magnum, and also cerebellum here. And this is the meningioma here, as we see here. This is the meningioma in T2. This is a calcification of the meningioma. There is also a line here between the brain and the meningioma. Sometimes the meningioma can also, penetrate the bone and reach the scalp, as we see in this picture. There's a lot of signs of meningioma here. The duratail, I'm sorry, this is some pars and spoke wheel. Sometimes in DSA, there is a signs called mother-in-law. This is because it's called the venous face will be long, to disappear, like your mother-in-law or something like mother-in-law which stay in your home cannot leave your home. Sorry. Here are those patterns of the meningioma. This is like flower here in the anterior fossa of the brain. Here is the sagittal sinus meningioma. As you see here, this is occlusion of the superior sagittal sinus. Another focal enhancement of the dura, we have metastasis to the brain. We have here metastasis here in T2. This is the with contrast also the false sign enhancement in other in the same patient of the of metastasis. Here another picture or another disease, lymphoma, which can cause also focal enhancement of the dura. This is a biopsy done for tibial bone, which indicates this patient has a lymphoma in the brain. Multiple cerebral dura mater masses here which shows a restricted, diffusion here. Number 3, we have also the leptomeningeal pattern. We have 3 kinds or 3 types. We have a thin bilateral here, and thin unilateral, and thick nodular. The thick nodular would be, seen in carcinomatosa and also lymphoma, fungal, sarcoid, and thin unilateral is also in the sarcoid and the vasculitis. For thin bilateral, we'll see that in meningitis, like Byogenius, and viral, also fungal and carcinomatosa. This is the infection meningitis here, as we see here in this picture. CT shows, frontal, sinusitis, and also this is a subcranial bubbles, as we show here in this CT. The T2 and flyer shows abnormal signal in the left forehead and frontal lobe, and high signal intensity in bilateral sulcus. DWI can shows no diffusion limitation of this infection here. As contrast enhanced MRI shows multiple linear enhancement and frontal in the frontal lobe here. This is a picture of a CT, which shows this is a fracture here in the posterior wall of the frontal sinus, with here bubbles, and there is abscess here, and this is the cause of brain or infection in the brain. There were, here also abnormal intensity or signal in the anterior pontine cistern, also the supraciliar cistern, bilateral ventricles also. Diffusion, was here restricted on DWI. The final diagnosis was hemiphalus flow type B meningitis and ventriculitis. This patient is a 55-year-old gentleman. He was immunocompromised patient. He has in the cerebellum, in the sulcus, this is enhancement here. Also in the paraventricle and perivascular space was abnormal enhancement. That was, suggested to be a cryptococcal meningitis. Some patients may, appear as a basal ganglia pseudocyst. Sarcoidosis is the main manifestation was this basal, meningitis, including the supraciliar cistern. Meningitis at the base of the brain is usually caused by, sarcoidosis, also the TB, syphilis, or any other, granulomatous, diseases or process. Here, the same patient, the CT showed here a sarcoidosis disease in the chest. The brain, sarcoidosis, we have here multiple leptomeningeal nodules, which shows, low signal intensity on T2. Another spinal, sarcoidosis disease will show the perimeter of the spinal cord shows, a white or white signal here. And also, as we see here in the spinal cord, there is what's called trident sign, as a very important signs of the sarcoidosis invade the spinal cord. This patient also shows some here dura involvement, also optic nerve involvement here in this picture. TB, or it's called, tuberculosis, meningitis, a meningeal, thickening and enhancement of the cistern is the most, seen picture of the TB. As we can here also see, there's some small rings in the hippocampal, right, and also left occipital sides. metastatic tumor here, as this 9-year-old boy presented with medioblastoma, which disseminated a leptomeningeal metastasis to multiple area in the brain, so showing enhancement and also sugar coating signs seen in the interior of the pons. Lung cancer can show also leptomeningeal enhancement and also cranial nerve involvement, which shows also cranial nerve to enhance here, as we see here in the pontine angle here. This is leptomeningeal enhancement. Also, this is here a nerves which can shows enhancements in the lung cancer patient. Enhanced, T1 flare shows, here also abnormal enhancement around the brain stem and within also the cerebellum, sulcus here. This is what can see in the cancer patients, as we see here. This is a nodule here and nodule here. Number 3, we have also what's called, gyral enhancement, which may be seen in the ischemia, migraine, also Boston seizure and SMART and PRES, encephalitis. Firstly, we have a subacute infection here. Infarction. This here in the infarction. This is the gyriform will enhance. That maybe will take 2 days to 2 weeks after infarction, and maybe last for 2 months to show this gyral enhancement. Patient also here, this is one patient with breast carcinoma with this brain MRI shows enhancement of the gyral, which actually found to be like ischemia, not related to the breast cancer. Patient here with COVID, we know that COVID infection sometimes progress to infarction to the brain due to coagulation dysfunction. Well, here shows a gyral enhancement in the brain. Stroke-like migraine after radiotherapy was called SMART syndrome. This is a rare late complication of brain radiotherapy. It's characterized by 1, cortical swelling and gyriform enhancement. Patient usually present with migraines, sometimes seizure, sometimes they will have like hemiparesis, and it is a self-limited disease. Here, patient with glioma in the brain, he underwent radiotherapy, as we see in post 2 years that after radiotherapy and surgery, the gyral is starting to have here enhancement. This is a gyral enhancement here. This is what's called post radiotherapy enhancement. So here also we have herpes simplex, virus encephalitis of both ankle in this area. This can also shows, or on MRI will have enhancement of the gyral here. Here we're moving to other enhancement, was called perivascular enhancement, which can be seen in PML iris and also demyelinization diseases, vasculitis, clippers, also lymphoma, radiation necrosis, encephalitis like herpes, and also metastasis. So starting with PML iris, it was called progressive multifocal leukoencephalopathy. Immune reconstitution inflammatory syndrome is activation of GC virus infection after immune improvement. The clinical symptoms will worsen after immune also improvement. As we see here, this is multiple active enhancement, perivascular enhancement in the brain. We move to another disease called clippers. Clippers is a chronic lymphatic inflammation that increase a perivascular wounds in response to steroids. It's difficult sometimes to distinguish this lymphocystic inflammation from the lymphoma. As we see here, this is, a brain stem, hyper signal and dot line enhancement, which, diagnosed with clippers. I know metastatic tumor here also can shows a perivascular enhancement around the brain. This is a stage 4 lung cancer patient who received immunotherapy, treatment, and initially was diagnosed with PML iris and finally confirmed with, metastasis. We moved to another, enhancement was called, periventricular pattern. This will be defined or, divided to a thin enhancement around the ventricle system and thick enhancement around the ventricle system. The thin enhancement, this maybe is called, ventriculitis in case of abscess, also ependymitis, like, seen in CMV infection. Thick enhancement seen in lymphoma, subependymal metastasis, GBM with subependymal spread. Here, a 60 years old man with headache, fever, and lethargy MRI shows ependymal enhancement and abnormal enhancement in the ventricle system. This image was very not specific, when abnormal enhancement of cranial nerve here in this area here and also here is present. The image should consider here a Lyme meningitis. The clinical diagnosis was, Lyme meningitis and ependymitis. Here, ependymal invasion of the brain in the brain abscess. This is the brain abscess here with, invade the ependymal of the ventricle system. Lymphoma, as we see here, CT shows, high density area. So T2 here show low signal, and this is a thick enhancement around the ventricle. Ependymal, dissemination of the GBM here, the GBM here, the dissemination of the GBM and spreading of the GBM to the ventricle system. We have also here moving to a nodular and swelling enhancement that can, seen in metastasis, lymphoma, multiple sclerosis, septic emboli. As here we show, this is a metastatic, metastasis usually located in the very important here node, or that's metastasis will located in watershed or in the white matter junctions. As we see in this is the clear picture. A lot of small metastasis here. This is the picture, shows us this is the tumor between the gray and white matter junction or watershed area. Maybe it will be like, metastasis. Moving to, PCNSL, this is called primary central nervous system lymphoma, is account of, 6 to 7% of all central nervous system neoplasm. Histologic, histopathology is B cell, non-Hodgkin lymphoma. Most of the, this PCNCL, located in, around the, ventricle system, corpus callosum, and basal ganglia. CT will show, high density, and T2 image show mild hypointensity with limited diffusion. In many cases, edema is not always limited. In immunocompromised patient, enhancement can show, circular. This is, a lymphoma here around the ventricle system. There's edema around it. And also here is enhancement in the around the ventricle system. Here another disease called macroglobulinemia is infiltration of the central nervous system and is rare disease and is known by Ependymal syndrome. Septic emboli in young patient with sepsis will shows multiple abnormal signal in watershed, also gray-white matter junction. Limited diffusion here, as you see, is the nodular or secular enhancement in the brain. Multiple sclerosis will show a nodular or open ring enhancement. This is will maybe suggests activity of the disease. Here is a typical corpus callosum lesions. Paraventricular also it's called Dawson fingers, also fried as egg signs. This is the most seen in the multiple sclerosis. Moving to the smooth ring pattern enhancement that can be seen in the abscess, also low-grade glioma, also resorbing hematoma, multiple sclerosis, toxoplasmosis, subacute infarction. Firstly, we'll talk about biogenic abscess. It will show hypointense lesion on T2 and SWI, double rim in SWI, enhancing ring, and also restriction in DW in the central of the abscess in DWI. Also, the CRB can be normal here, sometimes no clinical signs. This is an abscess here in the brain. They will show a double ring sign here. And also there's restricted central diffusion and smooth ring enhancement. Low intensity of abscess wall was common on SWI, PWI, and also showed decrease RCBV. This is a case of a subacute infarction here in the cerebellum that shows annular enhancement. That's maybe caused by hyperperfusion after ischemia. Irregular ring pattern can be seen in the necrotic tumor metastasis, resorbing hematoma, GBM, lymphoma in immunocompromised patient. This is the GBM here. As we see, no central diffusion limitation here in this tumor. This is the GBM also. As we see, irregular enhancement of of the cyst, and also here a brain metastasis from lung cancer. The black dots sequence shows on the left shows the lesion more clearly here. Multiple also metastasis as we see here in the right parietal is sometimes more like glioma. Abscess and secondary ependymitis with limited here central diffusions suggest the abscess diagnosis. This is here a ventriculitis here. 50 years old woman here, target sign highly. This is with target sign is suggest with toxoplasmosis here. A high signal intensity on T1 margin and low signal intensity on SWI. This is and margin and the center is limited diffusion on on DWI. It was here suggested this is a hematoma with absorbed and no tumor was found during operation. The opening of demyelinating lesion is more outward. Why the opening of the abscess is more towards the ventricle. Here opened outside towards periphery. This is called maybe demyelination disease. Where is opening to the ventricle? That's maybe abscess. Multiple here sclerosis, DW center, no diffusion restriction, no mass effect. Opening of the ring enhancement toward outside. Here another case of multiple sclerosis. The central venous dilation sign is seen here. Although open lobe enhancement shows opening of the towards the ventricle, the central nervous dilation sign is more seen here. This is opening sign here. This is opening sign of the ring. Enhancement of the open loop of the bones suggest of the demyelination diseases, as we see here in this picture. Demyelination of the cerebellum peduncle also is visible in patient with PML, which can shows here. A brain abscess secondary to frontal sinusitis with open lobe enhancement opening towards the ventricle system. This is here the frontal sinus infection or abscess, which extends to the brain, and the brain is starting here. This is the ring, which has opening to the ventricle system. Lastly here, this is with the moral nodule, which can seen in the polycystic astrocytoma and hemangioblastoma, also ganglioma, and also PXA metastasis also as uncommon. Here is a polycystic astrocytoma, a nodule, a big nodule here. Sometimes the cyst will enhancing or not enhancing. This is optic and polycystic astrocytoma. Sometimes we find a difficult diagnosis with craniopharyngioma, but craniopharyngioma, it has sometimes calcification. Hemangioblastoma is more common in adults. Wall nodule here, and it can see in it's called von Hippel-Lindau diseases. Hemangioblastoma here in a 27-year-old male with parietal nodule on the leptomeningeal sign. This is, we'll see a partial nodule here, partial nodule in the cerebellum. Ganglioma is in 13 years old patients. GBM similar sometimes to the gangliomas, so it's difficult sometimes to distinguish GBM from gangliomas. Here is a 50-year-old woman with primary diagnosis of hemangioblastoma and metastasis. The nodule were not located on the surface of the leptomeningeal and did not enhance significantly. Finally, they proved to be a metastasis here. So this was the last picture of our lecture, and we'll continue our lectures in next brain talks. Lastly, I will say we wish for Gaza to be safe and Allah with them. Thank you so much.